Before we get started, just a quick note. This video is for general information only and doesn't replace advice from your GP, pharmacist, or diabetes care team. Always follow your prescribed treatment plan and speak to a healthcare professional for guidance tailored to your situation. So, does Mounjaro make your skin more sensitive to sunlight? It's a question that comes up a lot, and it's absolutely worth knowing the answer. Mounjaro, known generically as tirzepatide, is a once-weekly injectable medication licensed in the UK for treating type 2 diabetes in adults. It works by activating two receptors, GIP and GLP-1, which help your body manage blood glucose more effectively. It also slows digestion and reduces appetite, supporting weight management alongside diabetes control. Now, to answer the question directly, Mounjaro is not classified as a photosensitizing drug. There's no official link between taking Mounjaro and increased sun sensitivity documented in UK regulatory guidance, so you don't need to worry that this medication is making your skin more vulnerable to UV damage in the way that some other medicines can. That said, there are still some important things to be aware of when you're spending time in the sun whilst taking Mounjaro. The most commonly reported side effects are nausea, diarrhea, vomiting, and constipation. These gastrointestinal symptoms are usually mild to moderate and often settle as your body adjusts. But here's where sun exposure becomes relevant. If you're experiencing any of these symptoms and you're also out in the heat, your risk of dehydration increases. And dehydration can affect your blood glucose control, which is exactly what you're working to manage carefully. So staying well hydrated throughout the day, especially in warm weather or during physical activity, is really important. When it comes to sun protection, the standard advice applies to everyone. Use a broad spectrum sunscreen with at least SPF 30 and a 4 or 5-star UVA rating and reapply it regularly, especially after sweating or swimming. Wear protective clothing and try to avoid direct sun during peak UV hours, which in the UK are generally between 11 in the morning and 3 in the afternoon. It's also worth avoiding injecting into areas of skin that are irritated or sunburned. If you're taking Mounjaro alongside other diabetes medications, such as insulin or sulfonylureas, your risk of hypoglycemia or low blood sugar may be higher. Heat and physical activity can influence this too, so speak to your doctor about how to manage your treatment safely during warmer weather or more active periods. And if you're planning a holiday or spending more time outdoors, it's a good idea to have a conversation with your GP, pharmacist, or diabetes team beforehand. They can give you personalized guidance on monitoring your blood glucose and staying safe. Now, when should you seek urgent help? If you experience persistent vomiting lasting more than 24 hours, severe abdominal pain, or signs of dehydration, such as feeling very thirsty, dizzy, or producing very little urine, contact a healthcare professional promptly. For urgent but non-emergency advice, you can call NHS 111. In an emergency, always call 999. You should also seek urgent attention if you notice signs of an allergic reaction, such as swelling, difficulty breathing, or a severe rash. To recap, Mounjaro is not a photosensitizing medication, so there's no documented increased risk of sun sensitivity from the drug itself. However, gastrointestinal side effects can raise your dehydration risk in warm weather, which in turn can affect your blood glucose. Standard sun protection, good hydration, and avoiding injecting into sunburned skin are all sensible habits to keep up. And if you're ever unsure how sun exposure or warm weather might affect your treatment, speak to your GP, pharmacist, or diabetes team. They're there to help. If you found this useful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information. Drop a comment below if there's something specific about Mounjaro you'd like us to cover next.